thank you for coming out on a rainy Saturday in the Bronx. We're so thrilled to have you all here. I'm Diana Gray with the Hydrocephalus Association. I'm the CEO, and I've been in my role for almost a year. I'm 6 weeks shy of my anniversary, and it seems like it's been 3 months. So we must be having a lot of fun because time is flying. It's been a really amazing experience. I wanted to put someone on the spot. We have Cliff Goldman from our board of directors, so raise your hand, Cliff. We're thrilled to have you here in the audience today participating, and a number of staff that you'll get to meet. But I especially want to thank Dr. Rick Abbot, and I'll introduce you to him in a minute. But he put this all together. He's the one that secured all this amazing medical talent that you're going to hear from throughout the day, and these great presentations. And Montefiore Medical Center for hosting us. We're really appreciative of this, and we're really hoping that we can rotate this event at some of our other New York area hospitals, so that we can do this in another year and the year after that, so that we can spread it around. But also, of course, we want to thank all of the talented speakers today, and we appreciate you. Most of you are there, so I'm going to kind of look that way. So we appreciate you being here to share your knowledge with the many folks in the audience today. So I only have a few minutes that I want to tell you just a little bit. I could speak for an hour, but I'm not gonna. Just a little bit about the Hydrocephalus Association. Obviously our mission is to find a cure and to improve lives of those who are affected by the condition. And we do that by collaborating with patients, caregivers, scientists, physicians, and we have to fund research and ultimately find ways to treat and cure this condition. But the true vision is to really have a world without hydrocephalus. That would be the ultimate goal for us. So that's what we're in the business of doing. Just quickly, and I won't go through all of these, but I want to put them on the slide so you see the vast array of support and education programs that we offer through the association. You'll see that there are programs for teens, community networks. We have some representatives here from our community networks volunteering today, and I'll show you the map in a minute, but there are about 40 sites across the country where local folks are becoming resources to bring people together with hydrocephalus for educational purposes and for support. We just had our national conference in June in Minneapolis, and it was our largest ever. We had about 462 people on site, and total we reached 1,119 people because for the first time ever, we offered virtual attendance. So people that couldn't travel in, couldn't take the time off work, could actually watch some of the sessions in a live stream format. So we want to continue to do that and do better, but we're looking forward to hopefully having another conference in 2018 and even expanding that number even more. So we're very proud of that. I wanted to tell you about Hydrocephalus Connect, which is going to be a new peer support program that we're putting together where you can say, I'd like to meet somebody in my own community who has had a similar experience to me. I met a woman yesterday in Huntington, New York, who said she's never met anyone who had the same experience as her with hydrocephalus. And she said, I'd be happy to be one of those peers to talk to others. And so we're hoping to put that together. Transition Summit, we're very excited about, and we're bringing together experts from across the country in Seattle in February to really dive into this issue of how do we transition kids to adulthood in terms of healthcare, in terms of managing jobs, looking at all kinds of different issues that happen as you transition from childhood to adulthood. Even helping to coach parents in some cases to help kids have more independence and own their healthcare. Very excited about that. And then last thing I'll talk about on this list is Hydro Assist. If you have not looked up the app Hydro Assist, it is a wonderful application. All you have to do is type in Hydro Assist. It's a free download, and it's a way that you can download on your phone, and I think I've got pictures of it right there. You can download the location of your shunt, the type of shunt you have,
any kind of medical information, contact information that you want to have, so you can be mobile with that information. So you're going to your doctor's office, you're not trying to gather all the papers or try to remember who was my manufacturer, was it Codman, was it Ask? You'll have it all in your app. And 2.0 of this is going to be coming out hopefully in the next few months, and it will be shareable, so that once you get it on one person's phone, both parents could have it, or parents and the child could have it, and so we think that's going to be a great addition. But we've had more than 1,000 people download the app, so we're very excited about that. And then I promised you the map of community networks. This is where we have locations where people are offering support in their local communities. Here in the New York City area, Alana Schwartz and Carly Rodriguez. I don't know if they've popped in the room. Yes, stand up. I see Carly back there. Alana may still be out in the front. No, there's Alana. So they welcome you to some of their meetings, and they've been a huge part of putting this together today, and we thank you for that as well. In Long Island, we have a community network with Mia Padron and Jackie Davidson. Mia and Jackie, are you here? They know they're here. They may be still up front. And then we have others in Connecticut, and I met a gentleman today that wants to start one in New Jersey, so we're already networking. There you are. He's going to help us out in New Jersey, so thank you very, very much. So those are our community networks. Our research program. We didn't have a research program in 2009. I mean, the organization had been really focused on support and education, which is incredibly important to be a resource to families and individuals. But we had a visionary named Paul Gross who said, you know what, we really need to be focusing on the cure. And we've put together this amazing research program designed to try to fund as much high impact research being conducted in hydrocephalus. Just quickly, these are the areas we've been focusing on since 2009, and we've invested more than $4.5 million to support research in hydrocephalus. One of our biggest challenges, obviously, we're investing 22% in trying to get young scientists interested in hydrocephalus. That's going to be the key to growing more research. The newest area that we've been focusing on, and I'll show you on this, is our HANDS, our Hydrocephalus Association Network for Discovery Science. For a while, we've had our clinical research networks, both adult and the pediatric focused clinical research networks, and they're amazing. They're creating a lot of research outcomes, and it's very important that they're doing what they're doing. But we had been missing that basic science. Who's looking at what's going on with CSF? We have who's looking at what happens when we throw away the shunts. We have a scientist named Carolyn Harris out of Wayne State University who examines all the shunts they'll give her that are taken out after surgery, and she's looking at those cells and trying to figure out, is there some commonality in those obstructed shunts? Is there something going on there? And so we're very excited about looking at the whole continuum of research. I'm very proud of our approach to research. This year, our Innovator Award will be focused on post-hemorrhagic hydrocephalus, and to really look at the mechanisms and the development that leads up to PHH and trying to look at new therapies around PHH. We hosted a research workshop and brought in scientists into Bethesda at the NIH. And for the first time, we brought in some scientists who weren't the same folks who've been working on this for years, but we brought in people that weren't necessarily working on hydrocephalus. We had some blood-brain barrier experts. We had a stem cell expert. And the scientists who've been working on this and the scientists who hadn't kind of got together and got excited about potential outcomes, and they're collaborating. And one of our dear folks who'd been working with us for many, many years out of Hopkins wrote to us and said, we moved the needle more in hydrocephalus research in 2 days at this research workshop than she has seen in 20 years. So it's all about bringing great minds together to think about this problem in different and new ways. So we're very excited about what's happening with the PHH initiative. And we've launched a $3 million campaign to raise money to try to solve this problem. So how can you get involved? Well, first of all, you're here today. That's one great way to get involved. But you can be an advocate. I was just on the Hill a week ago for our Rally for Medical Research, talking to members of Congress about why we need to fund more More projects in NIH. They, for the first time in many, many years, they got a $2 billion increase. We asked them for another $2 billion because that's what it's going to take to prevent the long-term consequences in healthcare of not doing research and investing in research now. And so this is one of our dear volunteers out of our walk chair, actually, in Boston, Jennifer Miles, with me. You can also come walk with us. We have 38 walks across the United States. We had our first walk in New York City ever on August 28th, an incredibly hot day, but it was a beautiful day in Hudson River Park. We had about 120 people come out, put it together in about 6 weeks. So we're excited about next year when we can get 1,000 people to come out to the walk. But we have had an incredible walk in Long Island for 13 years, and it's growing. So if you're in the New York area, there are options for you to get involved and help us increase awareness and funding for hydrocephalus research through our walk program. So thank you. I'm going to introduce Dr. Rick Abbott in just a second, but we have an incredible day planned for you. This is a very unique opportunity to hear from some experts in hydrocephalus who have donated their time to be here with you today and tell you more about living with hydrocephalus and help you understand more about the condition. And they're available to talk to you in the breaks and at lunch if you have questions. So I want to thank Dr. Abbott for putting this together. He's a member of our medical advisory board. He is a neurosurgeon and scientist. He's been with Beth Israel, with NYU, and now he's with Montefiore. And he's a great friend and partner. So we thank you, Rick. Thank you.
Thank you, Diane. I want to thank you all for being here and welcome to this event. Diane was saying that I had been responsible for organizing all this, and I got to say that the team of speakers you're going to have today, it didn't take any organization. It was just like, bang, yes, let's do it. It wasn't very long into our discussions before we're talking about how do we keep this going, because we all, every speaker that you'll hear this morning recognizes the importance of doing this sort of thing and is committed to educating you and your family about this condition. So we all welcome you, and as a group, we'd like to thank the Hydrocephalus Association in supporting this, because it's to have an organization that mounts this kind of an event is extremely helpful to our care for you and your family members. So thank you for letting us do this. So just briefly, I'll go through what today's format is. This morning, we're just going to kind of go through a series of talks to give you the basic background that we feel is important to manage hydrocephalus. So you're going to go from learning about what's involved in the body's normal mechanisms that results in hydrocephalus, to how do we treat hydrocephalus, what are our options, to problems that we have with the treatments and how we handle those. There's going to be a particular talk on infection a little bit later, and then I'll finish the morning with a discussion about headaches in hydrocephalus. And then this afternoon we're going to have a series of breakouts that are just basically discussions. Each one of the moderators for those breakouts will give you a little background information, but it's more just to stimulate your questions. So I encourage you to come to those sessions prepared to get your questions answered and just to network with other people that share your interest in the topic. That's the plan for the day. Now, you all got a feedback sheet that is asked you to, just a couple of questions about each one of the presentations this morning to let us evolve the information that we're giving to you and try to do a better job when we do this event again. So if you please give us your comments about the presentation, so we'll understand how far off the mark we are, and also give us some comments. You'll notice on the last page that there's some comments about other topics you'd like to see discussed. So that will be very important in putting together next year's event.